My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to today's clinic. Today's clinic is our maternal and child health clinic every Sunday from about this time to 1 p.m. 12 p.m. is in Eastern time in US, but if you're in Nigeria, it should be your 5 p.m. So in the next 45 minutes, we're going to talk about male infertility, the male aspect of infertility, and we're going to be in a better position to know what male infertility is all about. So I will encourage you to quickly rally and introduce yourself. So when you come in, let me know who you are. And as soon as we have a good number, we're going to start the clinic. Okay, so when you come in, do me a simple favor. Let me know who you are. Tell me your location. Focus on my admin. As soon as we have a good number, we're going to start. Today, we're going to look at the fundamentals of male infertility. And we're going to look at the things you can do to actually have a good outcome if you have male infertility. So when you come in, please confirm you can see me. Confirm you can hear me. Focus on my admin. Make sure you're following. So please type in something. Tell me your location. Tell me your name. That way we can identify with you. Then focus on the admin. Once we have a good number, we are going to start. So it's important you confirm this. Today we're going to look at the males, part of the whole equation. Becoming pregnant is not just about the woman. It also involves the male. So we're going to look at male infertility. What are those factors that can lead to male infertility? So please quickly come and let's get started. So thank you, Doris from Atlanta. Thank you and welcome. Focus on the admin. Admin will soon join. When admin comes, you're going to follow the trends. Admin is going to share the link to the group. If you're not in the group yet, make sure you join the group. Make sure you join the page. Make sure you join our YouTube. Make sure you join our Instagram. And also, if you follow me in Facebook, you can also participate. So our broadcast this afternoon is going to be on 5 different platforms. If you're in my group, if you're in the page, if you're in YouTube, if you're in Instagram, and then if you're in my private group, you can join and you can participate. So regardless of the platform you belong to, please come, let's talk about male infertility. This is a very important aspect of your family. It's possible this is the reason why you don't have your babies today. And we're going to give you solutions on what you need to do. So my number to beat is 50. Once I have 50, I'm going to start. So please, when you come in, introduce yourself. I can see Chiazoka from Boston, Frances from Bielsa, Doris already from Atlanta. Thank you and welcome. Please, when you come in, introduce yourself. I need to know who you are. I need to have a personal interaction with you. We need to make sure we have enough services in your location. The reason why I'm interested in your location, especially in Nigeria, is to see how I can allocate resources in your location. So there are a couple of places you can get help. The reason why we set up this group is to help everybody having problems with becoming a mother, with becoming a father. So assuming you're in Oka is within our catchment area. I can refer you to a gynecologist. I can refer you to a fertility specialist within Oka metropolis. If you're in Enugu, I can do the same. If you're in Lagos, I can do the same. If you're in Port Harcourt, if you're in Owerri, if you're in Asaba, if you're in Kano, if you're in Lokoja, if you're in Osun State, I can set you up. If you're in Abuja. So this is the reason why I need to know your location so I can see how I can factor in your own wellness. So Wadi from Nigeria, we're in Nigeria. Gladys from Abuja, and Wendy, the last time I remember there's one Wendy from Canada. Is it the same Wendy? Chia from Dublin. So guys, keep coming in, invite your friends. If you know anybody that will benefit from today's clinic, please invite them. It's going to be a meaningful conversation. So many men are having problems right now. So many families are having male infertility issue, not the female part. So it's possible that the problem is not you. The problem might be your man. They might have told him he had low sperm count, no sperm, and all those stuff. This is the moment we need to come in so we can have meaningful conversation about this in the next 45 minutes. Okay, Wadi, you're from Port Harcourt. Now, when you come in, focus on Chi Evelyn. She's the moderator, and she's going to take care of you today. If you need any help, she will soon publish the list of the places you can get help. So if you're in Abuja, Asaba, Awka, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, and Port Harcourt, we can refer you. The criteria for referral, you have to be a subscriber. So you can come in at 1 week, you can come in at 1 month, you can come in at 3 months, and you can also come in at 6 months. Whichever one you can afford, please go for it. Now, if you are already pregnant, please make sure you also enroll in our ANC group in Telegram. If you are also believing to become a mother, that's the Believing for Baby category, also please enroll in the Telegram group in our Believing for Baby group category. Now, hopefully, any moment from now, we're going to release our app and our website, and I will encourage you to make good use of them. It will make things a little bit easier for everybody. Okay, now remember that on the 30th of this month, we have a very big event. So many of us love multiple pregnancy. Who wouldn't want to have 2 babies at a time? Who wouldn't want to have 3 babies at a time? Who wouldn't want to have 4 babies at a time? It's possible to have 2 babies at a time. It's possible to have 3 babies at a time. It's also possible to have 4 babies at a time. Any woman can have multiple pregnancy, even when you don't have a family history. So come, let's fellowship. The guest speakers for that event are gonna be female panelists, Nigerian trained best doctors practicing in the best places in the world. You do not want to miss this opportunity. So if you've always been wanting to have twins, to have triplets, to have quadruplets, this might be an opportunity to get the knowledge you need. Knowledge is power. When you use knowledge, you can change your attitude. When you change your attitude, you can change your practices. When you change your practices, you can change your perception. When you change your perception, you can be a mother. It has happened before. It will happen again. There will be so many pregnant women that will have more than 1 baby in this group in 2022. So many of our members are going to have triplets. So many of our members are going to have quadruplets. Some people might even want gender selection. In as much as I don't love that particular aspect, because I believe that whatever God gives us is the best, you can also have gender selection. But please, the clinic today is for what? Male infertility. So every person having male infertility issue, this is an opportunity for you to know exactly what male infertility is all about. Okay? So I have 32, so I'm still looking for probably about 18 people to join before we will hit the target. But we might not necessarily wait for you. If you guys are not ready, we're going to start with the people in attendance. Okay, so please remember, when you come in, introduce yourself. I need to know who you are. I need to know your location. Then once we are done with your location, we're going to open the clinic. So when you come in, introduce yourself, tell me who you are, your location, then we're going to get started. I'm just giving a little leeway so that everybody that needs to attend will be in attendance. Remember, you can attend through YouTube, you can attend through Instagram, you can attend through the page, you can attend through the group, and you can also attend if you're my friend in Facebook. You can go to my private timeline and you can participate. Now, please wait for me to finish my presentation. Then afterwards, you can ask all your questions. Okay? So thank you for coming. And I'm actually going to start. We don't have all the time. I have a lot of things to do. So you see, today's topic is fundamentals of male infertility. So it actually takes both parties to have babies, right? So the problems regarding male infertility can actually come from 3 aspects of the males. It can be the problem with making the sperm in the first place. So the problem of male infertility can come from what? Making the sperm itself. It can also be a problem of moving the sperm. So some men might not be making the sperm. Now, some men might be making the sperm, but are not moving the sperm. That's transporting the sperm to the penis and making sure it gets to where it needs to go to perform its role. So the problem can be lack of production of sperm. Producing the sperm by poor transportation. So if there's a blockage, if there is anything impeding the transport of the sperm to the right place, you can have infertility. Now, we can also have the problem of functionality and the ability to penetrate and fertilize the egg. So 3 components can lead to male factor infertility. Inability to produce the sperm, ability to produce the sperm, but inability to transport the sperm, ability to produce the sperm, transport the sperm, but the sperm is of poor quality. The sperm is not able to penetrate the egg. Now let's go back a little bit. Let's start with the basics. How babies are made, right? So a man creates the sperm in his testes. Now, after creating the sperm in the testes, the sperm is also stored there. The sperm is stored in a special tubing attached to each other. These tubings are called the seminiferous tubules. That's where the sperm is stored. So long as a man is producing sperm, that's actually a good thing. The biggest problem in infertility in regards to male is the inability to produce sperm. If a man can produce sperm, and the problem is transportation, we can use a micro-invasive procedure to collect the sperm and introduce it back to the woman. But if a man is not producing sperm at all, that's a very big problem. So of all the 3 problems that can lead to male infertility, the most critical ones are the ones related to not producing the sperm. Producing the sperm is very, very, very important, because once it's produced, if it's blocked, we can fix it. Now, another big factor that leads to infertility in male, it's the poor quality. So if you notice, if you guys have been looking for a baby and you present yourself to a fertility specialist, what do we normally do? We do what we call seminal fluid analysis. So we collect the partner's sperm, right? Remember that sperm is invisible to the eyes. What you see after ejaculation, it's the semen. That's not the sperm. Now, for every family going through infertility, we want to check the sperm. When we are checking the sperm in the man, what are we checking? 3 things. The quantity, it's called the count, right? The motility, and the morphology. These 3 criteria will tell us if your partner is good to go. So if your partner is having infertility problem because there is poor transportation, then it's likely it's a blockage somewhere. If we can unblock that place, you can still be able to impregnate your woman. In the event you are not able to unblock it, we can open you up and collect sperm because you have sperm. Then we can collect that sperm and we can introduce it to the lady about the time the lady is ovulating. When we do this, we can defeat infertility. You can have your 1 baby, you can have your 2 babies, you can have your 3 babies, you can have your 4 babies, so long as you have quality sperm. So the common denominator in becoming a father, in becoming a mother, is quality egg and quality sperm. Now, the world of men, it's somehow, in a very good advantage, right? A man can easily get a woman pregnant at age 100, right? But a woman cannot become pregnant once she's gone into menopause. So men have an advantage when it comes to reproduction. So if you're a woman, you need to pay attention to what I'm telling you now. The major factor in determining if you're going to have a baby or not, it's in you, your age. The biggest factor in becoming a mother is the age of the woman. Because the younger you are, the more the likelihood you're going to succeed. The older you are, the difficult it becomes. But you can become a mother, but your chances are limited from age 35. So like I said, many people confuse semen with sperm, right? Semen is what you see at the peak of sexual intercourse when your partner ejaculates. Ejaculation means at the peak of sexual intercourse, the man pours out the contents from the penis. What you can see visibly is the semen. Sperm is invisible to the eyes. You can only see sperm through the microscope. Now, in a typical ejaculation, in a normal healthy male, you have about 150 million. I want you to pause for a moment and think about this. You have about 150 million sperm released through the penis. In less than, it's just like in a teaspoon. So in a teaspoon of semen, you have about 150 million sperm, of which only 1 will succeed in getting the woman pregnant. I know you'll be wondering, so why do we bother about the this, the that? It's just the way it is. So males are very wasteful when it comes to the process of reproduction. So the nervous system, which coordinates everything in the body, is very important in producing the sperm. So the nervous system involves your brain, your spinal cords, and every other aspect of your body. When your brain is having problems, your brain can affect the production of the sperm. This is why that men that have problems that affected their brains, it can affect the production. So your brain is very cardinal in everything you do in your life. Also, men that have spinal cord injury, let's assume you had an accident and you became what we call quadriplegic, you might also have problems. So the central problem in male factor infertility is what? The production of that sperm. So long as that sperm is produced, you can have an opportunity to become pregnant. Now, for a woman, it's important you're conversant with your cycle. So your cycle is the interval between the 2 months you're bleeding. So every woman should know her cycle. Your regular cycle is 21 days to 35 days. That's the range. So if every 21 days you bleed, is expected to be normal. If every 35 days you bleed, is expected to be normal. But the normal regular one, the commoner one, is 28 day cycle. That means every 28 days you bleed. Now, when you are bleeding, you can use it to calculate your ovulation, more especially when you're younger. So a woman is expected to ovulate 2 weeks after her bleeding. Remember, your bleeding is calculated from the very first day you bleed. So if you want to calculate your cycle, you have to start counting from what? The first day of real bleeding. Don't confuse it with spotting. Spotting is not part of your bleeding. Some women can spot for 2 days, then they bleed for 3 days. Your actual bleeding days is 3 days. Some women can bleed for 3 days, then they can spot for 2 days. Your actual bleeding days is 3 days. Don't include the spotting. Spotting is not part of your bleeding. So you need to pay attention to this. Now you need to be conversant with your ovulation because your ovulation is at the center of everything. So couples are encouraged, younger couples are encouraged to make love about the time you have the best potentials of becoming pregnant, which is 5 days before the period you're gonna ovulate and a day afterwards. But this is for younger couples. This is for younger women. So long as you are not bleeding, our rule of thumb in this group is to do what? To continue your love making. Regardless of if you're ovulating or not, whether you know you are or not, just make love around the corner, 48-hourly interval. That's what we preach in this group, because the more you engage in love making, the more you're increasing your chances of becoming pregnant. So many people might be shopping for IUI, so many people might be shopping for IVF, and suddenly you can get positive pregnancy test. You can even have twins, you can have triplets. So whatever the situation is, don't lose the sight of your love making. So timing is very important for younger couples. But if you're not young, just make love around the corner. Now, across the border, infertility is described as the inability to become pregnant after a period of 1 year of unprotected sexual intercourse. 1 year. Now, this 1 year is applicable to women that are below 35. If you're above 35, 6 months. If you're in your 40, immediately. So if you're doing everything we preach in this group, which is PPP. PPP is the summary of SGHS. Anywhere you see SGHS, just include PPP. Admin, capture this. SGHS equals PPP. The first P is praying. We are very prayerful. We pray to God a lot. The second P is what? Playing. Making love 48-hourly. The third P is what? Practicing. Registering for the masterclass, coming for the round table, getting the PDFs, seeing your fertility specialist, going for help because you need help. So if you practice PPP religiously, you will become a mother. You will become a father. There is absolutely nothing that can stop you because there are so many ways you can get help. But if you stand in your own understanding and you refuse to seek help, it might be late. Now, statistically, we've noticed that 85% of couples having unprotected sex will become pregnant within 1 year. 85%. If you are religious, if you are newly married, before you begin to listen to your friends, before you begin to pop your Clomid, go back in, go and make love. You will become pregnant. But remember, a good mother is already a good mother by the time she's already getting her body ready before she becomes a mother, right? So a good mother is not the person that is already giving birth to a baby. No, a good mother is a mother that is eating healthy, exercising, taking the prenatal multivitamins, avoiding putting any silly things in her body. That's a good mother because you are already a mother. You do not wait to have your baby before you call yourself a mother, because every woman is a mother. So after you've done all this, then we identify the problems. Then you need to seek help. Now, there are a couple of issues that can lead to problems in male infertility, classically. But I want you to remember the three broad spectrum problems that males can have, right? Producing the sperm, transporting the sperm, and the quality of the sperm. These are the three areas that men can have problems. Now, listen to me carefully. If your lifestyle is messed up, you might actually be the problem to yourself. If your man drinks around the corner, smokes, eats nkwobi, doesn't go to gym, it's not sleeping properly, that problem is from him. Your lifestyle can directly and indirectly lead to problems of becoming a father. So the reason why you might not have a baby today is because you're drinking a lot of alcohol. The reason why you might not have a baby today is because you've added a lot of body weight. Why is this important? When you are not living healthy, when your lifestyle is messed up, it can affect the production of the sperm in the first place, because your male hormones are not going to be optimal. Your testosterone is not going to be optimal. Let me give you an example. If you're truthful to yourself, when we were in secondary school, in university, we all had high libido, right? That's when you want this girlfriend, everybody wants to have a girl and all this stuff. But piggyback, you're probably in your 30, you're probably in your 40, you're probably in your 50. You no longer have that zeal like you used to, unless you're taking some aphrodisiac or you're taking Cialis and all those Viagra out there. But if naturally, if you pay attention to your body, you will notice that the more you're stressing, the more you're adding body weight, the more you're not sleeping in the night, the more you're pursuing money, the less you are interested in lovemaking. And if you're not interested in lovemaking, you're not going to be a father. It is not a magic. For you to become a father, you need to meet with your partner. So your lifestyle is very important. If you are the guy that demolishes all the nkwobi and drinks all the beer in the community and takes all the alcohol in the community, you are bragging. Do you know the number of bottles I can finish? That's not a good thing to brag about. That might be the reason why you don't have a baby. If you're a man and you're not exercising, you have been sitting on the couch since you woke up this morning. You've been eating all the food at home. You're watching soccer, you're watching movies, you're making money, but you're not moving yourself. The problem is coming from you. You have to drop down your body weight. There are some men that can no longer see their penis. If you strip yourself off and you want to take your bath and your belly has covered so much that you can't look down and see your penis, you have a problem. You need to seek help. So by dropping your body weight, by keeping a check in your BMI, you are helping yourself. Now, every man is encouraged to take their daily male multivitamin. Why do you need to take your daily male multivitamin? Because you are exposed to stress. So many men are looking for money in deadly places. So many men are losing their lives looking for money. What will it profit you if you gain the whole money in the world but you don't have kids? Let me ask you, genuinely, how can you have billions, millions, this, cars, houses, and you don't have a kid? Who will continue your generation? Who will continue the family lineage? You need to wake up, my brother. This is not, you're not impressing anybody. You are doing this to perpetuate your family. The same way your father gave birth to you is the same way you need to give birth to your own kids so that your family lineage will continue. But if you keep pursuing money, if you keep going to the club, if you keep smoking and drinking and doing all those stuff, and you might think it's money, and you might think it's fame, and you might think you've arrived, you are actually dying in installments. The overall picture is the fact that if your lifestyle is messed up, you're not going to live up to your life expectancy. You're going to die before the time God says you're going to die. So many men are dying in their 40s, in their 50s, in their 60s. But that's not when God said you're going to die. You're supposed to die in your 90s, in your 100s. So you need to change your lifestyle. Some of you spend all the money you will use to see a fertility specialist. You spend it on impressing people that don't even care about you. You spend it on buying clothes, on buying cars, on buying houses, on things that don't matter. But you don't spend the money to a fertility specialist. You're not going for IVF. You're not going for IUI. You're not going for fertility treatment. You don't even follow your woman to the clinic. You don't even know what the problem is. You're blaming her. Meanwhile, if she steps out, there are so many women, the moment they have a boyfriend, they will become pregnant. There are so many of you listening to me right now. Like, I don't know the characteristics of people attending. I only know that 36 people are attending. I can categorically tell you this. If we come to a particular family and they're having infertility, if they don't understand that it's 50-50, there are so many women that if they venture to have relationship outside, like some men do, they will become pregnant. You know, my duty is to tell you your truths. I'm not afraid of anybody. So you better call a family meeting. As a man, I'm talking to you as a man. Call a family meeting. Follow your wife. Listen to your wife. Subscribe. Go to a doctor that will tell you the truth. Some of you already have the poor diagnosis. You have low sperm count. You have no sperm. There are some men that have no sperm, exospermic. Meanwhile, you don't want to get help. And you don't have any solution. And you don't even take your option. And you're believing to be whatever you are. If unfortunately you die, that's the end of your generation. How will you feel? Now, I'm going to mention specific things that can lead to this infertility in male. Number one is what we call varicose cell. Varicose cell. This is actually a problem we can correct. So when we have swelling, when we have accumulation of fluid in those ducts where sperm is stored, it can lead to blockage and transport of that sperm. So varicose cell is a common factor that can lead to male infertility. Thankfully, it can be corrected. Around 1 in 3 men who need fertility help with this abnormality can get help. This happens when you have bulging veins on top of the testicles. When you have this, you might likely not get your woman pregnant. You need to get help. Now, some men can have what we call undescended testes, undescended testicles. Now, in a baby's life, a baby keeps developing until the baby becomes old enough to be given birth to, right? Now, in males, the testicles, which is the balls, it develops from the abdomen. So it comes from your abdomen. As the baby is getting older, it's descending. Unfortunately, in some men, the 2 balls are arrested. They didn't develop properly. They did not descend properly. When you have that, it's called undescended testicles. If you have that, we can correct that, and you can have a chance of becoming pregnant. Now, some men are on some medications. There are some men that have cancer. Unfortunately, they are placed on chemotherapy. Chemotherapy is a medication that can also affect your ability to become pregnant. Some men also use steroids. Some men go to the gym, they want to look macho, they keep taking all those steroids. Those anabolic steroids can affect your fertility. Some men are on medication for seizures. Some men are on some antihypertensives, which we call calcium channel blockers. Some men are on some anti-androgen medication. Anything that affects your hormone production as a male can lead to infertility. Now, some men have some genetic problems. Now, also hormone imbalance. So any of the things I mentioned, once it's discovered, it's important that the male books appointment with a urologist. Every single man who is not able to father a child after 1 year, if your woman is below 35, please book appointment with a urologist. You cannot do this by yourself. When you're booking an appointment with a urologist, you might also likely meet who we call reproductive endocrinologist, so that both of them can manage and find what the problem is and begin to help you. Now, some men can also have what we call retrograde ejaculation. So instead of the ejaculation to be coming outside, you are ejaculating on the inside. So instead of the sperm to be pouring out, it's pouring on the inside. There are a couple of women that complain about that. Oh, after lovemaking, during lovemaking, my partner doesn't ejaculate, ejaculates inside. It can happen to you. If we discover that, we can see what we can do for you. Now, some women have what we call anti-sperm antibodies. So these are immune cells that kills the man's sperm. When we notice any of this, we can help you. but we can't help you if you don't seek help. So this, in a nutshell, it's the summary of the important issues that can lead to male factor infertility. So in summary, moderator, I want you to pay attention. I'm going to award the first prize for today for attending the upcoming roundtable in multiple pregnancy. So the question I'm going to ask now, I want you to pay attention, and the lady that gets it correctly will attend free of charge. What are the three main areas you can have problem in the male? What are the three principal areas that males can have problems regarding fertility? The person that gets it correctly, please shortlist her and send the name to the COO and make sure they attend the multiple pregnancy roundtable on the 30th of this month, free of charge. Now, if you haven't registered for this event, you will have yourself to blame. Look, if you haven't attended any of my classes, you won't understand. This might be the opportunity you've been waiting for. You might have been crying all these years, you haven't taken your bold step, and when God remembers you, God will give you more than one baby. Okay, so admin, shortlist the person that got the right answer first. What are the three areas that might make a man not to be a father? What are the three principal areas? I started with it. The person that gets it correctly, please shortlist them. Right now, the clinic is open, and I'm ready to take care of your questions. So please go ahead and ask your questions. The clinic is currently open, so it's time for questions. But please shortlist the right person that got it correctly and make sure the person attends the clinic free of charge. Okay, guys, let's go. Ask your questions. We have about 15 minutes to take care of your questions. So please ask your questions. Okay, let me see. All right, guys, the clinic is open. You can ask your questions. Today, we're talking about the male factor infertility. Okay, so IFI-OGE, inability to produce, inability to transport, and finally the quality. So I think the first person that got it correctly is IFI-OGE. So admin shortlist this lady, amazing lady, very smart. She got it exactly correct. Inability to produce the sperm, inability to transport the sperm, and finally the quality of the sperm. That's the right answer. Okay, guys, keep asking your question. Doc, you have a multiple pregnancy last year. Do you need to attend again? Of course. I mean, a multiple pregnancy summit is what we do every year, and things change every year, right? So knowledge is something that you have to renew. So every single year you need to renew your knowledge. So if you attended the last one, why not? Okay? If you got it correctly, you didn't make any mistakes. So Chi Evelyn, if you confirm that she's the person that got it correctly the first time, shortlist her. I'm actually impressed with her feedbacks. Guys, please keep asking your questions. The clinic is open now. In next 15 minutes, I'm going to take care of your questions. Please ask your questions. Okay? I'm not surprised the clinic is not like highly attended because a lot of people are not interested in this topic. They want a quick fix. So I'm not surprised with the numbers. Okay, but guys, ask your question. This is an opportunity to get feedback from me directly. Okay? Do you have any questions? I'm waiting to give you feedbacks. Please ask your questions. So Wayo Mavis, yes, you have to register if you want to register. It's strictly optional. So if you feel like you want to get more info about multiple pregnancy, why not? Okay. Good evening, Doc. You and your partner are done all the tests. Fine. HSG shows your tubes are patent, no fibroid, no cyst, your husband motility percentage. We are 8 months in marriage and yet we have not achieved pregnancy. So how old are you? If you're below 35, still try for 4 more months. Remember, you start panicking, you start seeking for help from 12 months. If you're 35 years and above, about this time, you need to go and seek help. Some couples can have what we call infertility of unknown origin or unexplained infertility. If you have unexplained infertility, you can also go for assisted reproductive technique. So you can try IUI, you can go for IVF, you can go for surrogacy. So, but for everything, for whatever reason, please keep making love. If everything is okay, like you rightly mentioned, and you're not becoming pregnant, then we need to know why. So you need to find a fertility specialist, okay? Guys, keep asking your questions. Does sleeping around with different women prevent a man from impregnating a woman? There is absolutely no connection with that. The only thing I know, if a man is sleeping around with different women, guess what the man is going to do? The man will likely pick out the sexually transmitted infections from those women. And if you guys are in a relationship, the man can transfer the sexually transmitted infections to you. But there is completely no connection. If the man is fertile, if the man is, if the man has quality sperm, he can get all those women pregnant. So there is no connection. What's the solution for erectile dysfunction? You need to see a urologist. We need to place you on some drugs. So there are some specific drugs we can give you if your partner is having erectile dysfunction. So what's erectile dysfunction? Dr. Nietzsche, thank you and welcome. Erectile dysfunction means your man is not getting good erection. The penis doesn't get erect. And if your penis is slipping, you can't make love and you can't become a father. Okay? Guys, keep asking your questions, please. Keep asking your questions. This is an opportunity for the males. Where are actually the males in the clinic? Where are the men in the clinic? It's the only women that attend this clinic. Please don't go back today and start blaming these women if you're not taking good care of yourself. Listen to me carefully. If you guys are looking for a baby and the man has not submitted his seminal fluid analysis, he's not serious. Any man listening to me right now, I'm talking to you directly. If you haven't gone for check of your semen, of your sperm, to know if the problem is coming from you, you are not committed to be a father. You are not a good father. You don't even have any business married. You have to submit yourself. The same way your woman is running up and down. Run up and down. Let's find where the problem is coming from. Stop parading yourself as if you're the father of the community when you can't even go for your check. And it doesn't matter who the problem is coming from. We're not interested in the problem. We're interested in the solutions. But don't keep telling the woman, oh, woman, go, I impregnated women when I was young. Then, that was then. This is now. Submit yourself, please. We don't have time. Okay? Can a man that have birth before have low sperm count? Yes. Any man can have low sperm count anytime. A man that got 12 women pregnant in 2020 can begin to have problem in 2021. The same thing can happen to a woman. A woman that had 12 kids growing up and suddenly she became married and she can no longer have babies, it's possible. Anybody can have any problem, including a virgin. Okay? So don't ever think that people that are having problems regarding having a baby, that they did something wrong. No. There are so many virgins that have been looking for a baby for 20 years. Now, there are some women that had 20 abortions growing up. They are looking for contraceptives. It's called God. God doesn't punish us by denying us good. God still blesses us even with our evil, even with our sins, even with whatever we have. God will single you out and bless you. But the problem most times is your lack of knowledge. We always look for people to blame. Our society, oh, he did this, they did that, is because of, no. If God is judging us, nobody can even stand. We would have been gone by now. Okay? What's the minimum count that needs to impregnate a woman? We need the 3 criteria, not just the count. We need the sperm count, we need the motility, we need the morphology. So I don't have your seminal fluid analysis. I would have given you one or few tips. But the most important thing you need to do is to present to the urologist. That's all you need to do. Now, someone is asking me about a particular antihypertensive they gave you as an expecting mother. If you are hypertensive, this is the best advice I will give you. That's a risk factor. If you are diabetic and you're pregnant, that's a risk factor. We need to manage you appropriately. So if the dosage they gave you is the dosage that your doctor gave you, definitely it's for you. It has to be tailored for you. I cannot override your doctor's prescription. I cannot override your doctor's plan. Like a woman came to me and she was telling me the doctor wanted her to go for CS because she went for her ICSI. ICSI is a special type of IVF, and the doctor wanted to section her at 36 weeks. That's a good delivery plan. Your doctor foretell the problems you might have if you go beyond 36 weeks. So your doctor is trying to be careful. You do not want to spend millions going through IVF, going through all those pain, and we lose your baby. No good doctor will do that. So if your doctor feels you're going to have problems and your doctor wants to go for elective CS, yield. So many of you are struggling. I want to have vaginal delivery, and vaginal delivery might not be the way God wants you to deliver your baby, and you might be wanting to do things your way, and you will kill your baby. So you don't fight, you yield. Okay? Yield and follow your doctor. How many months can a man that has 10, this is not mathematics, my dear, it's not a quick fix. Male factor is one aspect of the fertility. So make sure it's corrected. If your man is having male factor fertility, let your man go and seek help. But it's not mathematics. So what do I mean by that? Your man might be having low sperm count or problem, and we can correct the whole problem, and you will still not be able to become pregnant. Why? Because fertility is a multi-complex thing. We can fix this problem here, and this other problem hasn't been fixed. This is why we need everybody to come together so we can identify the problems. But the most important thing is that he goes to seek help. So it's not a mathematics. Like some people will come and say, oh, once you do this, once I remove my fibroid, will I be pregnant the following month? No, that's not how it works. Like I told you, 85% of couples who are making love religiously will become pregnant within 1 year. What's your religious love making? 48 hourly. The best time to get all the love making you can get is now. Make love. That's a fact. Kiddies change everything. They will invade your privacy. You will not have like a whole lot of things will change. So the best opportunity you have is now. Okay, guys, I have 1 more minute. Can someone without gallbladder get pregnant again? There is no connection between your gallbladder and getting pregnant. Okay, if you went for that cholecystectomy, it's done with. There is no connection between that and your pregnancy. Okay, guys, ask one more question. Dr. Nietzsche is in the house, so she's going to also take care of questions I didn't pick up. But this is your opportunity. Ask your questions just 1 more minute before I take my leave. Remember, tomorrow is our regular Believing for Baby category open clinic. So you come with your questions, I provide you feedbacks. Then on Tuesday, you join Dr. Ndiche. On Wednesday, you join me for my community health clinic. On Thursday, you join Dr. Ndiche. On Friday, you join me for 4 days Fridays. On Saturday, you join me for my ward round. Then on Sunday, you join me for my maternal and child health clinic. 7 days, constant, regular, life-changing clinics. You can't miss this. Remember to register for the multiple pregnancy roundtable on the 30th of this month by 9 p.m. 9 p.m. Nigerian time, 4 p.m. Eastern time. You do not want to miss this. This is going to be the mother of all super master classes. Please come and get the knowledge you need so you can become who God said you will become. Okay, so after this, if you haven't registered, follow the admin. The slots are gradually being filled. I think we currently have about 50%, and today is the 16th, it's the middle of the month. You do not want to miss this opportunity. This might be the chance you've been waiting for. Okay, so thank you for coming. My clinic is closed. Please remember to keep on doing the right things. Regardless, keep on praying, keep on playing, keep on practicing. Get all the equipment you need. Now, if you are having problems, seek help. The best way you can seek help is to get one of the packages. When you get one of the packages, you will have opportunity to talk to me one-on-one. You can come in for 1 week. It's called light package. You can come in for basic. It's called 1 month package. You can come in for 3 months. It's called classic. And you can come in for 6 months. It's called prime. So whichever one you can afford, please come. If you are already pregnant, please go to our Believing for Baby Lounge in Telegram. If you are believing to become pregnant, please go to our already set up Believing for Baby Lounge in Telegram. So these are the products we have, and we believe we can help you. We don't just want you to get pregnant. We want you to become pregnant and have your baby. I don't just want you to have your baby. I want you to have a healthy baby. I don't just want you to have a healthy baby. I want you to watch your baby grow old, watch them. You become a grandmother. This is my prayer for you. I want you to be a mother by latest 2022. Thank you for coming. My time is up. I appreciate you. I love you. Whatever happens, remember that God loves you, and please never forget that. Thank you so much for coming. Bye-bye for now.